everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This next section has to do with birth assistant training options. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only, not intended to substitute for professional legal or clinical advice. We strive to keep our information as timely and accurate as possible, but make no claims, promises, guarantees that this will be accurate for your local situation, your local needs. So please just double check with the local regulatory standards. The course objectives. The student will be able to verbalize exactly what is a midwife assistant, birth assistant. They'll be able to explain the differences between doulas, assistants, and midwives. And they'll be able to explain how to become an actual midwife birth assistant. And they'll be able to discuss what are the different training options available for becoming a birth assistant. So let's go to the basics. What exactly is a birth assistant? That's someone that is assisting a midwife during a birth, traditionally in the community setting, either with a home birth or a birth center delivery. And it's the scope of responsibilities and role and job varies greatly per midwife. So this course is going to just be telling you general. The midwife is usually using a birth assistant as that second person for an emergency situation. If there's a newborn resuscitation needed, there's a postpartum hemorrhage, there's a shoulder dystocia, there's a prolapsed cord, there's an emergency situation occurring, you want to have trained, skilled people around you that can calmly communicate with EMS. They can help with documentation. They can help with a newborn resuscitation. They have NRP, neonatal resuscitation certification. They can help with labor support if need be, depending on when that birth assistant comes. Some of the midwives will have their birth assistants come the same time that they do to the birth, and some of them will have more transition closer to delivery time, just depending on what their goals of you and your services are with that relationship. So that's a great conversation to have if you're thinking about becoming a birth assistant in a community. Having a great conversation with the midwife of like, what is your expectations as skills? Some of the midwives expect their birth assistants to have more nurse role and start IVs, being able to administer medications, and some of them it's more general breastfeeding support, extra set of hands, a lot of the just high level task delegation things. So it just depends. You have to have a conversation. They can come in early labor. They can come, especially when a mom's had a fast labor. There's been times where the birth assistant is there before the midwife. And so part of the training and part of the comfort level is if the baby comes before the midwife, you know the basics, you know what's normal, you know what's not normal. This bleeding around amount is normal. I'm going to call the midwife, see where she's at, or I'm going to call 911. You have to be able to know what to do in emergency situations. You've got to be able to anticipate what supplies to get out of a bag, setting up for a birth, cleaning up after a delivery, taking some high-level notes on a piece of paper, the time of the delivery, the time of the head, time of initiating breastfeeding. Maybe you did some basic vital signs. You could check a blood pressure, temperature, heart rate on mom or baby, depending on what skills and comfort level you have. So as a brand new birth assistant, if I had someone that was their first birth, I usually have for 3 to 5 births 2 birth assistants with me, someone with experience, training them, supporting them. Because if there is that emergency, you want to be able to have someone that can help with mom and with baby and call EMS. So there's a lot of things in those rare emergency situations. Once their skills build, we get a sense, we practice giving IM injections, we practice doing blood pressure checks, we practice IV starts if that's something they want to do. Traditionally, the midwives will do the heart tones and will do the vaginal exams. If you are a birth assistant and a midwife apprentice at the same time, that's a little different. You're going to be a little more advanced skills and expectations of a role, but being very clear, there are differences differences between doulas, midwives, and assistants. So we really want to be clear guidelines of if you're a doula, you're labor support, you're not going to be assisting with any task in an emergency situation, you're an advocate. Depending on which certifications you have as a doula role, that is a very different role as a birth assistant. A birth assistant can fill some of the roles of a doula. They can do labor support, they can help with breathing, they can help support the family, but a birth assistant has a lot more skills and training than a doula does at the birth setting. And responsibility, they're hired by the midwife. A doula is hired by the family traditionally. And then the midwife is the one ultimately responsible. They're the one doing the labor management, the decision making, working closely with the family, talking about all the risk and benefits. They're the primary person responsible for the emergency situations and determining what to delegate to the birth assistant. And they usually are the ones doing the documentation and the main high level management things. So basic introduction to birth, everybody is going to be different. Whether you've been around birth or it's your first birth being a birth assistant, it's nice for you just to be around it and exposed and comfortable, whether you're just saying, hey, can I shadow? I'm thinking about becoming a birth assistant. Really learn about normal physiological birth. Read lots and lots of books. Read about Ina May Gaskin. Read every book you can get your hands on. Ask if you can follow a midwife around. Ask if you can just get to know maybe a family or friend and ask to be part of their birth experience so that you can just get familiar with birth in different settings. In the hospital, birth center, home are going to be very different situations. A birth in the hospital, induction, epidural, a C-section is going to look very different than a birth that's natural in the home setting, a water birth. So the more experience you can get surrounding yourself in normal, natural settings is vital. It's absolutely vital as a birth assistant. You want to get a basic understanding of the mechanisms of birth, the cardinal movements, the normal processes, what are variations of normal, how to tell if there's warning signs and concerns, how to take basic vitals. Some midwives expect their birth assistants to do heart tones. It's more of an advanced skill. Be able to talk appropriately and calmly to EMS, to the family, SBAR, which is situation background assessment recommendations. So there's very specific basic skills that a birth assistant should have when they're considering being around a natural, normal birth setting. When you're starting to introduce yourself into the birth world, you want to practice skills. You want to take some great courses like this one. There's about a dozen online and in-person birth assistant certifications out there. There's no formal program or school, kind of like a medical assistant, kind of like a midwife. It's more of an informal certification process and an apprenticeship training, and everybody's orientation will be different. Some people that are a nurse and did labor and delivery, they just need to learn the out-of-hospital setting. If you've never been around birth before, we encourage you to do doula services and get some training as a birth assistant. There's a wide variation of getting yourself exposed to birth in that supportive role. The more you can practice doing vital signs, the more you can practice even just listening to the midwife as she's estimating the blood loss after delivery. You can get a sense of what's normal and what's too much and what clots are a normal size, and this, that normal skin to skin, that golden hour, the breastfeeding, the routine that happens those first couple hours after the baby is born. You wouldn't be ultimately responsible for only examining the placenta, but it's good, especially if you eventually want to be a midwife, you want to learn more than the average. Watch the midwife look over the placenta, see what she's looking for, open up and say, hey, can you explain to me your thought process? The more that you can learn, because if not all the placenta is intact, you're concerned about retained parts, you're concerned about extra bleeding. There's things that you can, as a birth assistant, start being proactive thinking about versus just waiting until the midwife delegates a task to you. So how do you exactly become a birth assistant? It's only needing a high school diploma, a GED. You can get on-job training. There's great online certifications. We have an excellent program that midwives have been using for years. AABC has programs. There's an extensive one in Alaska that's more fit for their needs in the rural setting, and it's far more comprehensive. So you really just have to look at your local state regulations. What are the midwives in your area wanting you to do? And then finding a a program that fits those needs and skill sets you're looking to have. There's a lot of great ways you can get midwives together, birth assistants together, to do some trainings, do some simulations, do some drills together, and be proactive to get the online and hands-on drills and training completed. You don't have to be a doula, you don't have to be a nurse, you don't have to be a nurse's assistant. They will just help because you're more familiar with taking vital signs, you're more familiar with labor support, you're more familiar with being around birth. So there's different programs out there, there's different variations of scope and practice expectations across the country for midwife assistants. So I always stress to people, figure out what comfort level of skills. Maybe with suturing, you're just holding a light, you're helping to keep things clean, sterile, handing things, instruments. But if you're a midwife apprentice, they may be asking you to help with the suturing. The midwife may be talking more through the suturing process. But the biggest thing, I think the number one skill set that any midwife is going to be expecting out of their midwife assistant, their birth assistant, is being able to support them during an emergency situation. That is the number one. If anything you can take away from this course, learning and memorizing the step-by-step needs, thought processes during an emergency situation. All the other things can take time, they can be learned, they can be slow and gradual, a learning curve. But with your first birth, being a birth assistant, you want to be able to know the prolapse cord, what's your role, what's the midwife's role, postpartum hemorrhage, newborn resuscitation. You really want to know the equipment, the skills to be able to support those emergency situations. You want to be able to look over the records of the midwives, find out, does she want you to chart directly on the records? Does she want you to chart on a piece of paper and then the midwife adds it to the records? You got to have some familiarity with medical terminology so you can consistently communicate with EMS, with the midwife, with anyone that is going to be in an emergency situation wanting information about what's going on with the patient. So it's really important for you to just have a basic understanding of dilation and the birth process, female anatomy, development, the presentations of baby, vertex, breech, cephalic, anterior, posterior presentation, the different stages of labor. You want to be able to help them the first couple hours of breastfeeding and transition and getting up to the bathroom, and this is normal bleeding, this is too much bleeding, they're feeling lightheaded, you're able to take some vital signs. You want to be able to do, most of the time, I want to stress over and over and over again, birth is a normal process. Most of the time you're going to be doing very casual support to the midwife and being so grateful you're around this amazing birth experience. But there are going to be times it can switch quickly. The placenta abruption, something happens, the heart tones go down, and you need to shift gears quite quickly to know how to handle non-reassuring heart tones, how to handle increased vaginal bleeding, how to handle a fast delivery coming when the midwife isn't quite there yet. So it just depends on, why are you becoming a birth assistant? Do you want to become a birth assistant because you're thinking about becoming a midwife? You are a doula and you want to be around more out of hospital births. You want to, you're in midwifery school and you want to make some extra money, and you really want to see different midwives in the community and how they do things. It really just depends on why you're becoming a birth assistant, why you're becoming a midwife, and having a conversation with that midwife, because the job description is flexible. They can do some training on site, they can give you a lot more education than the average birth assistant if they know you want to be a midwife or you're a midwife in training. So just as an overall summary, birth assistants are exactly what it implies. They support the midwife, they support the birth, they support the process that the midwife is doing. Once in a while, they will do some postpartum home visits and appointments, but most birth assistants are on call, available if the midwife needs second hand during the birth experience. If it's a first-time mom, you may not be called until more transition and pushing because we have time on our side, or it could be a mom that's had babies before and she goes fast. You may be going to the birth the same time as the midwife, so you could be helping her to set up the supplies, checking the equipment, getting everything situated, keeping the tub temperature right, inflating the tub, deflating the tub, cleaning up after birth. It really varies greatly what that midwife wants of you, and having great conversations with her of how soon when you're called you have to be there for a birth. What's the average time they expect you there for a birth? Um, some want you there as soon as the midwife is there, and some are going to want you there closer to delivery. It really just depends, and so you want to build up that relationship and clear written expectations of what this midwife's expectations are with her birth assistant. So just try to be careful not to mix up midwife, assistant, and doula roles. They're very different. A doula is hired traditionally by the family, a birth assistant is traditionally hired by the midwife, and a midwife is ultimately responsible for that birth experience. You have to be careful if you're a birth assistant and you have a nursing license, you have a medical license, and you're birth assisting for a midwife that doesn't have a license in that state. Maybe she has a national, international certification, but you have to be very careful, because if you are a licensed nurse and you're birth assisting a certified professional midwife, a lay midwife, and there aren't midwifery regulations, you are the one that's going to be held accountable for practicing medicine without a license. So you really need to be careful of knowing your state regulations, what you can and can't do within your scope of practice and license. If you have something, if you are just new to the birth community and you're a doula and you're thinking about being a birth assistant for a midwife, it's very different than a nurse or someone that has a medical license in the state. So you really just have to figure out, is this the right fit for you? Do you want to be on call? Do you want to support women during birth? Do you want to be that second person for an emergency situation? Be comfortable talking to EMS and doing an IM injection of Pitocin, helping with breastfeeding, cleaning up, helping with documentation. You just really have to know what you want and why you're becoming a birth assistant.